Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. I'm Health Director Pat Lopez, and providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us to learn about the latest local developments. Getting vaccinated and wearing a mask. These are two actions that are crucial to protect our community and help us get through this surge driven by the Delta variant. Our local situation remains critical, but there has been some change over the last week. We've seen cases start to level off, which is encouraging, but it's still too early to tell if this is a trend yet. Let's start out with our risk dial. Most of our indicators remain high and some move slightly higher. For this reason, the risk dial remains in the mid-orange range this week. Orange indicates that the risk of the virus spreading and the impact on our community is high. The key metrics of the dial are the positivity rate and case rate, which remain high in the red category. Deaths are in the orange. And the vaccination rate and contact tracing and testing turnaround time are in yellow. Healthcare system capacity remains in the elevated orange. The blue square outlined in red on the color-coded chart indicates the current position of the dial. Let's take a closer look at what our most recent data is telling us. The number of new daily cases is still high, but it is encouraging to see the 7-day rolling average showing signs of flattening. At the beginning of August, the average case rate was 58. After climbing to a high of 136 cases August 30th, you can see the slight decrease to 127 on September 2nd. We need to see this decline continue to reduce the risk in our community. Today, we added an enhancement to the COVID-19 dashboard. It's a new tab that tells us more detailed breakdown of the COVID-19 risk by age. I've asked Raju Karkapaludi, our public health epidemiologist supervisor, to join us today to provide a quick demonstration of where you can find the helpful information on our dashboard and how you can easily compare different age groups. Raju?
Thank you, Pat. In Lancaster County COVID-19 dashboard, we had cumulative data broken down by age group. Today, we added an enhancement to the dashboard. Now you can see weekly cases by age group. Okay. You can access this data by navigating the weekly cases by age group tab in the bottom of the bottom tabs in the dashboard. In this enhancement, you can use the slider on the top to select the weeks that you want to have a closer look. We use the most commonly used age groups. Now you can toggle the age groups using the legend in the bottom of the chart to select or deselect age groups that you want to see. In this visualization, I selected only 0 to 14 age groups. It gives us a cumulative total broken down by individual age group, 0 to 4, 5 to 9, 10 to 14 age groups by week. In Lancaster County, our peak weekly cases was on December 5th, 2020. That week, we reported 2,111 cases. Of our cases, in 0 to 14 age group, we had 194 cases that week, or 9.2% of all cases. Last week ending Saturday, we reported 1,025 cases, and we have 217 cases in 0 to 14 age group, or 21.2% of the cases are in that younger age groups. The proportion of cases in this younger age group week over week, the proportion of cases in the younger age groups week over week in recent weeks is higher than what we were seeing when we are in the peak surge. Thank you.
Thank you, Raju. I want to recognize the work that you and your team have done throughout the pandemic to provide accurate, timely data on the COVID-19 dashboard. The dashboard is a valuable resource for the people in our community and our state. And as Raju has just shown us, we currently have a higher number of cases in the younger age groups. That reflects outbreaks we've been seeing in child care centers and the increase in cases we've been seeing in the schools. Since July, there have been outbreaks in 20 different child care centers here in Lincoln. In the last 2 weeks, there have been close to 500 cases in school-aged children. This reinforces the importance of masking both in preventing illness and reducing the number of students who have to be excluded and quarantined. We continue to work closely with all our schools and child care centers to keep our children healthy and in the classroom. This is essential for learning and for their social and emotional development. The impact of COVID-19 has devastated many families with severe illness, school absence, loss of work, and even death. Well, August was particularly hard with increased cases and hospitalizations, ultimately leading to deaths. Our community lost 30 people to COVID-19 in August. 9 of those who died were under the age of 60, and all 9 were unvaccinated. They included 2 people in their 50s, 3 people in their 40s, and 3 in their 30s, and 1 in their 20s. We feel for the loss of these for their family members and our community. From March through August, we have lost 52 community members to COVID-19. 83% of them were unvaccinated. And sadly, we're reporting an additional 3 deaths today. All were males, 1 in his 40s, 1 in his 50s, and 1 in his 70s. 2 of them were unvaccinated, and 1 was vaccinated. The number of COVID-19 patients hospitalized locally continues to be high, but the increase slowed over the past week. You can see that since the beginning of August, the daily average has risen from about 43 patients to 83. However, the 7-day rolling average has been between 81 to 84 over the past 8 days. Unfortunately, today, 93 COVID-19 patients are reported hospitalized, with 63 from Lancaster County, and 14 of these patients are on ventilators. Joining us today is Dr. Kevin Richmuth, a Lincoln pulmonologist who's been with us before. He is providing critical care on the front lines through the pandemic. He'll provide an update what he's seeing related to hospitalizations and share the latest information about monoclonal antibodies, a treatment for COVID-19 that can be prescribed to people who are at high risk for severe illness. Dr. Richmuth.
Thank you. So I think what I might do is first go through the monoclonal antibody information. And so about a month or so ago, kind of at the beginning of the surge, Dr. Diana Patera, primary care internal medicine physician here in Lincoln, and myself kind of were worried with what we were seeing and what other parts of the country were seeing. And this is a treatment that was originally EUA'd back in November of 2020 and had great utilization. CHI St. Elizabeth's here in Lincoln got it up and running, and personally, with a number of patients, found it very effective, and so did a lot of the community. And of course, as cases went down, when we did all the right things after the kind of original surge and started getting people vaccinated, it really kind of started being, I think, forgotten about a little bit. And so we wanted to reinvigorate, re-educate, bring awareness to it, especially to the primary care physicians and those who were its most useful. And so with the help of Joan Anderson with Lancaster County Medical Society and Pat and her team with LLHD, we started a process of putting that information out. And so just a little bit about this treatment. And I'm going to start off by saying This should not replace vaccination. This is not as effective as vaccination. But as somebody who, as I'll go through, may be a candidate for this is a tool that can prevent them from progressing and ending up in the hospital or worse, dying. And so this schematic that you see on the screen here basically just shows the coronavirus cartoon, and it's got these spike proteins all around it. And then what this therapy is our body makes antibodies when it's infected or gets a vaccination. And so these are what we call monoclonal antibodies. So they're synthetic antibodies targeted to this spike protein. And what happens, just like with our own antibodies, it binds to that, so it prevents it from binding to the cell and getting into the cell and then starting all that cascade of replication and all those bad things that happen after we're infected. And so that's kind of how it works. As you can imagine, this is, and I'll talk about one new indication, but in general, this is a reactive thing because you get the infection and then we give this to you. As you can imagine, it's got to be given quickly to have an effect. If you think about it, when you get a vaccination, those antibodies are already sitting there. So when that virus gets in, your own antibodies do this much more quickly than you can with an infusion. And for all the people who might worry, well, this is some unique, novel kind of thing, we use monoclonal antibodies just like this to treat other conditions, not just infectious disease, binding antibodies to certain proteins that cause other problems for patients with asthma, rheumatological conditions, all those kind of things. So it's not really a new therapy, it's just designed for this specific infection. And there's, you can go ahead and go to the next slide. There's multiple, essentially 3 products out there. The one I'm focusing on is the one that we use here in Nebraska by Regeneron, and that's the one that we really have. And so eligible patients, as you can see here, are really patients that we see in that highest risk group of progression. So patients over the age of 65 and then those comorbidities. I want to point out pregnancy. I just came out of covering the ICU over this past 8 days. I took care of more pregnant patients than I have at one time, I think almost in my whole critical care career, all with COVID-19, all unvaccinated. So this is another therapy for them, safe and effective for pregnancy to prevent disease progression. And then you see the list of other comorbidities on the right side, chronic lung disease, and you can find all of this. Next slide. And so the new indication out there that just came out here in May or June was, so patients who have had an exposure, so they have a family member, they live in long-term care and so forth, this can be used for what's called post-exposure prophylaxis. So in other words, trying to prevent the disease when we know they've had a high-risk exposure. And you can see on this slide, so it's really meant for those who aren't fully vaccinated or we don't think that they've had would have had a vaccine response. And so that's a little bit of clinical judgment. I would point back to the other group on the other one. I do want to point out here, regardless of vaccination status, this is an indicated treatment. So even if they've had vaccination, this can still be used. And I'd also point out the sooner, as I mentioned, the better. The best is within 5 days, but it can be used up to 10 days. Okay, so next slide. And then the next slide. So just some quick and dirty here. So how it's administered, it can be an infusion or now it can be a subcutaneous injection. We prefer the infusion method. The benefits, so in that group that has the disease that you're trying to prevent progression, 70% at preventing hospitalization and death. Again, I want to foot stomp. What are we seeing the vaccine efficacy at? It's over 85, 90% for preventing those two things if you're vaccinated. So this is not as good as vaccination. 4-day reduction in symptoms. And then in that prophylaxis group, an 80% reduction of going on to developing the disease, symptomatic disease. Risks, very safe. If you look at the data on this, there were more adverse effects in the placebo group, in particular the Regeneron study, than there were in those who got the Regeneron. And the risks the side effects that did occur were mostly local kind of things, itching, sometimes racing heart, those kind of things, but nothing serious. And then how do you receive it? So this is what's critical. We've gone on this campaign to remind all of the different providers out there, urgent carers, primary care clinics, offices like mine that treat inpatients and outpatients, that this exists. And as of today, Bryan is also offering it. So both of our healthcare systems have it. They both do a great job. They both have made it as easy as possible for a provider to order this. So this is where I'd say for you as a patient, you can advocate for it. You have to realize a lot of people go to the Naomi site out at Gateway and get tested, or go to a pharmacy. Your physician may not know you've tested positive. If you fall into that category or you have any question, contact your physician to see if you may be a candidate for this. There's a process that they go through more detail than I just did of what's called the EUA FDA fact sheet to make sure you want to do it, and they can get it set up for you fairly quickly. And so I think it's an important thing. So obviously there may be people outside of Lancaster County listening. This website allows you to see if this infusion is being done elsewhere. As this has gone, we've actually, many places when this was in the fall and continued, administer this besides just us here in Lancaster County. So it's widely available. Next slide. I think that might be the last slide. Okay. So, Pat asked me to talk about what we're seeing. This is very timely because I just came out of the ICU at Bryan East, and I got to say, it was a very challenging week. And all my partners and all the other people in the hospital, the ICU nurses that are just working their tails off through this, I think it's worse than what we saw in the first surge. And I don't mean to be overly dramatic here, but I'm in the military and I served in Iraq in 2004, and there was a week in April of 2004 where I was in a small area south of Baghdad, where it was absolutely brutal. One medevac with casualties after another. You'd think you were caught up and you'd think you'd catch a breather, and they'd call in with another medevac of casualties. This week, I think, rivaled that week. We had so many patients, and I will tell you, out of all the patients I took care of over this past week, only one was vaccinated. All the rest of them were unvaccinated. If you look at the current Bryan data, we have no ventilated and no ICU patients that are vaccinated. About 88% are hospitalized that are unvaccinated in total. And so I don't know what it's going to take for people to understand that the vaccine is working. When I talk to my colleagues throughout the country, we're all seeing the same thing. This healthcare capacity issue, all of those patients I took care of wouldn't have been in the ICU for COVID if they had been vaccinated. I'm 100% confident of that. That's how much faith I have in it. And so this surge and the impact this is having on our healthcare system and our community is all preventable with vaccination. I can tell you that it was demoralizing. You'd have somebody die or move out of the unit because they were or out of the isolation, and very quickly we'd get another patient in. Many times not from Lancaster County. We'd be taking them from somewhere else, even outside of the state, to help out. But I will tell you, every one of them, as I would talk to them about what I was seeing with their care and what I anticipated, all of that attitude about anti-vaccination that they had, and some of them had valid reasons, some of them had the unfortunate disinformation reasons that are out there. All of them were scared, wearing masks, unable to talk, seeing the fact that they may not survive or certainly may end up on a ventilator. And I took care of more patients below age 50 this week in the ICU than I have for a long time as well because of COVID-19. And so I would say that we need to listen to this data, listen to them, because every one of them regretted it. None of these therapies we have, once you're hospitalized, make the difference of preventing this by wearing a mask or getting vaccinated. None of them. I had a patient from out west who was given, a young lady, given ivermectin for several days, came into that facility with massive blood clots and almost didn't make it, got here. I don't know if we're going to be able to save her or not, but I think back to, you can't help but feel so bad that she was given the wrong treatment, not vaccinated, and here this young woman is on death's doorstep. And so none of these treatments that we have are as good as the vaccination. Frankly, none of them even are as safe as the vaccination. Some of the things we give when somebody's in the ICU, the immunosuppressing medications, have consequences. And so the vaccination is the best. Last thing I'd point out is that one common thing that I repeatedly hear, whether it's masking or getting vaccinated, is people being called sheep. And it really drives me nuts. I'm a big movie buff, and obviously being in the military, I love American Sniper. And if you go to the opening scene of American Sniper, there are 3 types of people in this world: sheep, wolves, and sheepdogs. Some people prefer to believe that evil does not exist in the world. And if it ever darkened their doorstep, they wouldn't know how to protect themselves. Those are the sheep. Then there are the predators who use, his comment was violence, I'm going to say disinformation and misinformation, to prey on the weak or the uninformed. Those are the wolves. When there are those blessed with the gift of aggression, and we'll take aggression out, but just say common sense and listening to the science, overpowering need to protect the flock, those are the sheepdogs. I say that if you're getting vaccinated, if you're following the guidelines with regarding to wearing masks, you're a sheepdog, you're not a sheep. You're protecting yourself, your family, and your community. So please be a sheepdog and not a wolf.
Thank you for being here, Dr. Richmond, and for your comments. I think a lot of times people hear us talking about vaccination and how important it is, and it's not that we're shaming people or we're telling them, it's out of genuine concern for their health and the health of our community. So I hope people hear that message and what we say. You know, as Dr. Richmond said, the vaccine continues to be our best defense against the Delta variant. In nearly 22,000 COVID-19 vaccinations were provided in August here in our community, and close to 60% of those were first doses. We now have close to 70% of our population age 16 and over fully vaccinated, and we continue to have the highest vaccination rate in the state. Every person vaccinated helps create needed protection for our community. We strongly urge all those eligible, once again, to get vaccinated. Even if you've had COVID-19, our recent studies show that vaccination can offer additional protection against reinfection. The vaccine is available every day at clinics and at local pharmacies. You can find an upcoming vaccination clinic at covid19.lincoln.ne.gov or by just calling us at 402-441-8006. You can also find local pharmacies offering vaccinations at vaccines.gov or by texting your zip code to 438-829. While we're on the topic of vaccinations, I want to take a moment to provide clarity on the difference between a third dose and a booster dose. The Center for Disease Control and Prevention now recommended a third dose of COVID-19 vaccine for people with weakened immune systems, like those receiving cancer treatment or who've had an organ transplant. These individuals are more vulnerable to COVID-19 and may benefit from an additional dose to ensure that they have as much protection as possible. We partnered with CHI Health, St. Elizabeth, and Bryan Health to host these third dose clinics, and about 650 third doses have been administered. Some local pharmacies are providing the third dose as well. A booster dose is different than a third dose. A booster is for people with normal immune systems, and it helps boost the existing protection a person already has against a disease. The use of booster doses is not new. For example, a tetanus booster is recommended every 10 years. COVID-19 vaccines continue to provide strong protection against severe disease, hospitalization, and death, as you've heard Dr. Richmond say. But it is common for protection from vaccines to decrease over time, and with the Delta variant, public health experts are starting to see some reduced protection against mild and moderate illness. A booster dose of COVID-19 could be needed to maximize protection. And to be clear, booster doses aren't available yet and still need to be authorized by the Food and Drug Administration and recommended by a CDC advisory committee. If approved, we will receive more information on who will be eligible for a booster dose and when. We're in the process of readying plans and locations for booster dose clinics, and we will notify the public once booster doses are available. Again, getting vaccinated and wearing a mask are two actions that protect our community and help us get through this surge. And we do want to remind everyone that the current directed health measure remains in effect through September 30th, and masks must be worn indoors. While our local situation is still critical, as we have said, cases have started to level off. To make this a trend and continue to see the numbers go down, we need collective action. We need everyone doing their part to limit the spread of the virus. That's why it's critical we continue our vaccination, masking, and other prevention efforts. We all play a role in this response, and our actions help drive our progress. Our actions have been and will continue to be guided by the latest data, and residents can track our local data via the COVID-19 dashboard. We also issue COVID-19 updates every day that include the latest data and information. And these are posted at the covid19.lincoln.ne.gov website. You can go on and click on the COVID-19 news releases button on the top left side. You can also find the updates on the city's homepage at lincoln.ne.gov. Just scroll down to the latest news section. If you have social media, you can follow the City of Lincoln and Lancaster County Health Department on Twitter and Facebook for COVID-19 information and updates. And if you have a COVID-19 question, or if you're seeking general information and resources, the hotline is operational Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'd be happy to take any questions.
We get a lot of questions into the newsroom about what is defined as unvaccinated. Is it possible for someone that has initiated that first dose or maybe inside that 14-day window from the second dose considered unvaccinated, or what category would they maybe fall into?
They would be partially vaccinated if you've had one dose. You have to have the 2 doses to be considered fully vaccinated.
And is that anything you're seeing in those hospitalizations, or are these people mainly fully unvaccinated, not initiated that first dose?
I think probably the most of them that I've seen are really unvaccinated. They're either vaccinated or unvaccinated. Any other questions?
I'll go. UNL is reporting a much higher positivity rate than we saw maybe in sort of the spring of last year. Is there any indication that there are clusters happening there? Is that maybe that daily testing that you're seeing more positivity rate? What are you maybe tracking trends-wise on campus?
Well, we have done isolation and quarantine in 4 sororities or fraternities, and we have one floor on the dorm. We're starting to see those numbers come back down again. Primarily, they have a fair number of students vaccinated, but we still see a large majority of these being unvaccinated individuals. So our numbers are decreasing. Okay. Any other questions? I think it's Matt.
Hey Pat, it's Matt Wolverine with the Journal Star.
Hi, Matt. I was wondering, I thought you might ask a question.
Well, I was curious, just in looking at the numbers, it doesn't really look like cases have leveled off. I mean, you had 1,000, I think I heard 1,025 last week, which I calculated was almost a 20% increase over the previous week. If they've leveled off, they seem to have leveled off pretty high. So, I mean, do you see any evidence that cases are going to start, sort of working their way back down?
You know, we're not seeing that evidence yet. We're just barely seeing the leveling off. I think we should all be hopeful that we're going to just continue in that same trend. But with our high hospitalization numbers, it's really just too early to tell. We need a couple more weeks of data. And if I can remind you, we leveled off and we stayed flat for a while last time, but we anticipate that once we start to level off, once we know that our spike has happened, that we are anticipating that we will go down quicker.
Okay, and on vaccination, are you guys seeing, you talked about 22,000 vaccinations in August, about 60% of those were first vaccinations. Are you seeing a lot of people from those groups where vaccination is lower, say like the 16 to 24 age group, or because that seems to be where a lot of the cases are coming, is those kind of under 40 or under 35 age groups, and that's also where vaccination, is the lowest.
Yes, that's true, and it's under that group, we're seeing those high numbers, and those youths are children 0 to 14, and then our other highest group is in that, I'd say 20 to 39 age group. But primarily a lot, if you look at the data on the dashboard in that very age group that you're talking about, Matt, we're starting to see more people in there, and you can look at the rates that are starting to go up.
And then one other question I had was just about events. I mean, it's kind of hard to tell whether, say, the Garth Brooks concert contributed to spread, at least here in Lincoln. It looks like maybe it might have contributed to spread statewide. But, I mean, with football games and things like that going on, are you concerned, or do you have serious concerns about what that's going to do with spread of the virus?
I of course I have concerns about any large event like that. In the Garth Brooks concert, from what we know, what we were able to track and what we can estimate out would be, we haven't seen a large outbreak. It's too early to tell if something like Husker football is going to matter or not. I have concerns. I know at Pinnacle Bank Arena, they did their best job to make sure that people remained masked and followed that. They had a lot of staff there, but a lot of people were just non-compliant. So we were talking with them about that. And I've also spoken with them about having performers who make comments that are not supportive of the efforts that we're making in our community to control the spread of the disease. I don't think that's really beneficial to anyone. We'll continue to watch what's going on with the football games, but I know the volleyball games, all the other indoor activities are really, they're doing a lot to encouraging the masking and watching the masking, and people have been pretty compliant. We've had a few complaints that we followed up on individual activities, but we are seeing most overall better compliance. But there is a lot of concern about having football outside. But we've worked closely with the university, and we continue to work with them. There is masking in the suites. There is masking in several areas there. But a lot of this is people need to understand what's happening, and I encourage visitors to our community to be mindful of what is happening here and why it's so important. Matt, there was one other thing that you brought up about maybe Garth Brooks causing possibly cases in other parts of our state. There is very low percentage of people who are vaccinated in western Nebraska and some other areas. And every health department in the state is being overwhelmed with the number of cases, the situations going on at the hospitals. There are over 100 and some nursing homes that now have active cases in our state. So, those aren't things related to Garth Brooks. Those were things that were already happening. And it's really behooves us, if we want to move forward, to follow some of these simple measures to keep our kids in school, to keep people, our economy thriving. We really cannot ignore it that we are in the throes of this situation.
Great, thank you.
Any other questions? Okay. Thank you for joining us today. And be sure to be well, wear your mask, and get vaccinated.